It may be sad for some of us, it is tragic for many.
This is not a political issue so much as an extremist issue.
It's extraordinary to watch what they're doing. Again, they're not explaining things, they're dismissive.
Facebook did do a ridiculous fact-checking warning on one of my PCR videos last year to limit people sharing it.
They punish anyone who discusses vaccine safety in anything other than glowing terms.
They accused us of being politicians and not scientists, and being more of acting towards political goals rather than scientific. And I was really angry to hear that. Number one, I'm very left-wing. I'm a Democrat, so to be insulted by my own party and discredited as someone who's looking for political gains or something, I thought it was just ludicrous.
Or the conspiracy theory, anti-vaxxer, code denier, and it's been reported all these names that they're getting called, and the pressure and the bullying and the ostracising, but their questions aren't being addressed.
The way the discussion is conducted right now is that, some fact checkers reach out to some experts, and then you have some one-liners in their report, some one-liners that, so to say, contradict what I'm saying. And then the fact checker confronts me with this kind of, contradictory statements, so to say. That is not a discussion. And that
A mindset of absolutism, of binary thinking, a my way or the highway kind of approach.
Unfortunately, politicians seem to think they know what medicine is for, and as they become increasingly unconscious, seem to believe they are bringing you health through even more regulations.
I really commend everything you're doing. What I've been doing here on the Pandemic Podcast has started with me picking up the phone in August last year and just saying enough is enough. I had to say my piece, but I had I was afraid to say what I was thinking, because of course the whole world is facing the other way, and any person that says anything contrary to the news is kind of smeared as some anti-vaxxer or COVIDiot or selfish, and it's just all of these pressures. So I'm interested in your views, in terms of the fear that nurses and other medical professionals may have about speaking out or about any concern they may have.
So naturally, the consequence is what impact is it going to have on them? And I'm concerned about the impact it's going to have on my income, ability to pay my bills. And that's a big one. I don't have children, so I don't have that fear, whereas a lot of the nurses reaching out to me have got young families, they've got kids to feed, shoes to buy, and all the other stuff. So I think that's possibly the thing that holds them back the most, that their financial commitments. But from a social level, it's that fear of rejection, it's that fear of being removed from the tribe, it's that fear of everyone else it is part of the gang, and you're the conspiracy theory, anti-vaxxer, code denier, and it's being reported all these names that they're getting called, and the pressure and the bullying and the ostracising, but their questions aren't being addressed. It's either bullying them, or it's government guidelines, it's government guidelines, it's government guidelines. Even if it doesn't make any sense and it's to the detriment of the patient, it's government guidelines. But there almost seems to be this hardcore group of people who, like you say, call us selfish or shame us into saying these things out loud. And I think once you've said them out loud, that's it. That's when you become a target.
Gets to the point where there are people who just genuinely don't want a debate. They're not open-minded enough to actually want to look at a different point of view. You send them 4 or 5 peer-reviewed papers, they want another one. You present another response to a debate point, and then they go to something else. It's like they don't actually want to entertain that there's a different point of view, and it's their last resort then is, you know, once you've presented potential logical fallacies in their argument, they then return to the age-old-fashioned insults and smearing as a way to eject the conversation. And that's
fault. Or we can have an adult-to-adult conversation where we'd have a debate and we'd look at the here and now and we'd be willing to compromise. Or we'd have a tantrum because you're not doing what I want you to do. And so I talk about that quite a lot. And what you were saying then about the link sharing. So one of the games that people play is yes, but. So they say they want help, or they say they want to listen, or they say they want to understand your point of view. And you share 5 links, they want 10. Yes, but it's not 10. You share 5 personal experiences. Yes, but that's anecdotal. You know, and this is just a game that people play. They don't actually want to be open to suggestion or open to debate. It's almost like lip service. So I talk a lot about that. And then, yeah, so the tactics that they use is then if that doesn't get through, then they start calling us names, or they'd simply say that we're so stupid that they just simply haven't got the time to spend because we would never understand. And yeah, there seems to be like certain responses that I'm seeing from people that just don't want to listen. And I think for me, what I find difficult is, are you allowed to swear on this show?
Go ahead.
Yeah. So one of the responses, so like to my sandwich board on Twitter was, I'm a nurse and I'm not scared to speak out, so fuck off. Like, well, I'm not speaking for you then, am I? Like, I'm not walking for you. But I find it really interesting that it almost feels like nurses are being pitted against each other. Like, if you're not that nurse, then you're not good enough, and if you're not that type of nurse. But what I ask for is a minimum is that people can at least consider that someone has had a different experience to what you've had. Just to consider that. That's all I can ask.
Through Facebook itself. So Facebook has taken the moral view that it's okay to effectively only position good news stories. And in fact, they've now got a section on Facebook which is dedicated to medical professionals who are saying positive things about the vaccines. But you know, it's prioritizing that now, and that I find that very difficult when simultaneously we've got an evidence campaign. We've got all kinds of devastating reports of really severe life-threatening injuries or worse coming through. And again, you know, for the disclaimers, for the fact checkers, I appreciate it's still rare, but it's rare within populations that would perhaps otherwise be unaffected by coronavirus. And again, disclaimer too, there are always exceptions. You know, I understand every medical, you know, if you're working in nursing, you'll know that, you know, every medical condition can still affect people who would not normally be affected. But that is the exception, not the rule. Yeah, we can't talk about that. And it goes back to risk perception. We can't talk about the adverse effects. We can't talk about the fact that the neurologist in one of the local hospitals saw eight blood clots in a night and wasn't able to put them down for the vaccines, even though there was no other tangible cause. But this is the world we now live in, where we can't even challenge, we can't even ask questions without it being censored or labeled as misinformation. But I believe censorship is misinformation.
But yeah, the censorship. So 3 of my videos have had the voice removed off them. 2 that I did last year in India, where I just said the C word when it was all new and no one knew what was going on and stuff. And then I did a video, so I complained about a Piers Morgan tweet where he said, like, you know, you shouldn't be allowed in restaurants, and it was awful what he said. So I wrote a complaint, and I read out the complaint, and that took my voice off it. And I'm not even that controversial.
No, it's extraordinary to watch what they're doing. Again, they're not explaining things. They're dismissive. And what will happen, and Bill Hennessy, my friend from St. Louis, wrote a blog post on this morning that's pretty extraordinary. It's very, he's a very persuasive writer, and he also is a very thoughtful man, and he tends to think forward. He is a fan of the book The Fourth Turning, and Bill will sort of imagine the future, and the future he imagines is if you it's dark in a way, not in a way, it's a dark future. But these bullies, they're not even trying, right? So we have an obligation. It feels to me like we either have to figure out what works for people, and there's plenty of people I know that believe the vaccines are good for them. They're not worried about side effects. I'll drop a footnote here. Clearly something's changed since, say, the polio vaccine, right? The polio vaccine happened in the 1950s, I suppose. It's an extraordinary story, and that saved a lot of people's lives, and it was effective. But since then, we have vaccines for lots and lots of stuff. And I don't think we have a real sense of how they interact. You know, when you have a baby these days, and my kids are, the youngest is 9, I guess, but you have a baby, they want to give you one after another in those first days after birth. So there's a lot to be wary of, and there's a lot to be especially wary of government requiring it. But back to my point on self-censoring, what's happening is the bullies are expecting that you won't want to be picked out, right? So 2 weeks ago, LeBron James refused to answer if he had the vaccine. Now, when someone refuses to answer, if you didn't have it, you say I didn't have it. I've not had it, right? If you didn't have it, you just say you didn't have it. What's the reason why is he probably did get it, and he didn't want to say that he got it because in large segments of the community that are fans of his, whether it's African-American or just basketball fans, I think they distrust it. But either way, you can bet your bottom dollar that what's coming is the vaccine bullies making sure that you'll feel left out or disconnected from the community, or worse, exiled, ostracized. Lady, come here. So that's what that vaccine bullies. And I think we have an obligation to create the space to try to break the bullies' hold on people and not fall victim to it. Again, plenty of people that I trust have the vaccine. My father got the vaccine. He's in a lot of categories. He was worried about it. He did a bunch of reading on it, said he wanted to get it. I don't have any problem with it. But the question is, what are the vaccine bullies going to do? And it's not so, yeah, she'll love California. It's not so much the passports in my mind. It's not even so much the requirement of 100% vaccinated workplaces, although I bet that's coming. Bill Hennessy thinks so. It's much more the vaccine bullies, the people that are going to make us want to self-censor and not stand up and say anything. So that's one.
Facebook did do a ridiculous fact-checking warning on one of my PCR videos last year to limit people sharing it. I rebutted their article here, but I'm not sure anybody who's conscious would believe anything coming from these so-called fact-checking sites. One wonders if they are now going to fact-check the UK's chief scientific advisor, Patrick Vallance, for making the following comments a few weeks ago.
Compare lateral flow tests to PCR, you'll get more positives with PCR because PCR is very, very sensitive. It can pick up very low levels of virus, which may not even be infectious. It may just be low levels there.
So now it's okay for him to say a positive PCR doesn't mean you're infectious. Rules for thee, but not for me. To be frank, the most censorship I have faced has come from within New Zealand. Up until last year, I was a TV presenter on one of the major networks, but that came to an abrupt end when I stated I wouldn't get a COVID-19 vaccine in one of my YouTube videos. And no, I'm still definitely not getting the vaccine. As you know, despite the promoted diversity and inclusivity themes in the current epoch, it is completely the opposite in reality. If you question something about COVID-19 or the vaccines, then they don't even want you included in the conversation at all. But I can tell you from my heart, this sort of cancel culture doesn't faze me. In fact, it shows me the path and keeps me connected to my work.
To the point, this is once again not science but social control. This is about messaging and narrative and reinforcing the good people get vaccinated and the bad people resist, and we can keep going down the lines of all of us will fall into at least one of these camps where suddenly we're not the good person anymore, and once that happens, once you recognize that, you go like, wow, you're not actually using logic with me. You've just decided that I'm not your tribe, and therefore you can hate me.
Yeah, I think it's about punishing independence. And it's also about making simple rules that do not force you to acknowledge a complexity. The idea that people who have had COVID should obviously get the vaccine too. That is anything but obvious. And the problem is, if you say, well, actually, people who've had COVID don't need the vaccine because they've effectively had a vaccine, and these vaccines are more dangerous than they should be because we know nothing about their long-term effect. So it's better to keep those people from having the extra risk. If you say that, there's risk, right?
Yeah.
So you've done that. So instead, we're going to expose lots of people to risk that they don't need to face.
This is not a political issue so much as an extremist issue. It's an issue with people who have a mindset of absolutism, of binary thinking, a my way or the highway kind of approach. And the only and best line of defense against these people, especially in a free country when we consider that all human beings at all points in history have been prone to this kind of overreach, is to call it out right away for what it is. And when we're talking about tyranny in politics, sadly that often results in dead bodies very quickly. But tyranny exists in all different facets of life and areas. Medicine and science, sadly, when you look at the history, has been traditionally one of the worst offenders. I mean, some of the greatest people of science and medicine have been horribly persecuted, from Galileo to Semmelweis, just for coming up against establishment viewpoints. This is a very human phenomenon, and it's incredibly sad that we've learned nothing from the last few thousand years, and we're still doing it in the 2020s. If we take the COVID pandemic response, for instance, I couldn't be prouder of all the frontline professionals, doctors, nurses, other professionals who have done a heroic job. But certain members of the establishment have still had this kind of mode of thinking which exhibits signs of absolutism, binary thinking, of not wanting to ever debate or discuss any alternative ideas. And I personally am willing to die on the hill of medicine and science always being open and free. You should always be able to put forward a hypothesis and test it and debate it openly and freely. Anything else is not medicine or science, and it must be called out immediately. And I found it very sad to hear stories over the last year of, especially in academic institutions, certain professionals, whether they're doctors or scientists, almost being afraid to have any type of counter viewpoint for fear of intimidation and consequences. That is not science. Have we not learnt anything at all? It is just unacceptable that that's happening, especially in countries like America and the United Kingdom, which are free countries. So going back to the original point then, be vigilant. Well, obviously at the highest level of politics in a free country, this is extremely important. As soon as you see any signs of overreach, it has to be called out right away before it escalates out of all control. But in medicine and science, what I would say to anyone who is in our field is, when you see these types of people, this mentality of a my way or the highway approach, I won't debate anything, I will silence and intimidate anyone who thinks differently, you have to call it out right away. That is the only way to stop things spiraling out of control and us ending up in a really bad place, because we should know better than that in 2021.
I do have the sense that we are watching, I haven't come up with a good name for it yet, but that effectively there's a thing, the good people game, right? And the good people game is like a massive online game, like it's literally a massive online multiplayer game. And the idea, there's a version on the left and there's a version on the right. And at the moment we are seeing the version on the left, which holds so many properties that, it effectively owns the whole territory. But the idea is that the good people game, that good people can be recognized by certain things, that you can just simply spot them, that good people will get their vaccine and they will boast about their vaccine status, that they will wear masks whenever they can be observed. They do not question COVID origins. They treat discussion of the financial incentives of vaccine producers as forbidden. They believe that science is reducible to a list of clear answers, which you just simply follow. They punish anyone who discusses vaccine safety in anything other than glowing terms. And they place greater good signals above the well-being of their own children and family. And frankly, I'm sick of it, right? I feel like the good people, the ones who actually care about science, are all permanently in a state of trying to sort through the nuances of these things. And what the good people game effectively does is it rules out the very territory that we have to go to, right? You have to be able to say, hey, Joe Rogan, you might be right about a 21-year-old who's healthy. You're not right about COVID not being a dangerous disease, right? You have to be able to say that. And to the extent that the idea is, oh, no, you've expressed nuance, you're not one of the good people, you're one of the bad people, then of course we're going to end with a disaster of one kind or another, whether it's of the sort that Geert Vanden Bossche is predicting, or it's as a result of unforeseeable autoimmune disorders that arise out of these vaccines, or who knows what it's going to be. But in effect, we have to have a much more open conversation, which isn't going to be comfortable for people, but it's the only way to get to a decent outcome.
Over at our site, Peak Prosperity, I think Kathy put it really well. Kathy said, I think it's disingenuous and intentionally so by the media, big pharma, et cetera, to claim that there is vaccine skepticism. I think in all of this, everyone should weigh the risks for themselves. If I were 65 plus, I'd be far more likely to get the J&J. A 25-year-old male should wait for better options or natural immunity. For a 45-year-old female with comorbidities, an mRNA vaccine might make sense. Being an educated consumer and trying to find the data to become educated doesn't make me a vaccine skeptic. I don't buy a car in the first model year. Why? Because it takes a year to get the kinks out. I don't have car skepticism. That was very well put. And it's true. I'm totally up to date on my tetanus shots. All of that, but I'm not, I want to see more long-term data on the mRNA vaccines in particular for myself. That's me. And so that's where I'm at on.
He had really liked my testimony back in May, and he was very pleased because he got a lot of calls apparently over the summer of doctors who thanked him for bringing me on and hearing the testimony because it encouraged them to use steroids. And they believe they saved a lot of lives. Yeah. And he knew of my work with ivermectin. Yep. And, I think he trusted my judgment, my expertise, the FLCC as a team. And he asked us to come and testify during his, he did a series of hearings about early treatment. And so I decided, whereas back in May I did it by Zoom, I decided to show up in person. He'd asked, he preferred that I show up in person, and I did. That testimony was interesting. It went viral, right? It got up to 8 million views, and then before it was taken down. And I don't know if you know this, but I was a little fired up that day. And one of the things that fired me up was that I was insulted by the ranking member. It's the minority party, and they walked out. They actually didn't stick around. They thought it was a fraudulent hearing. They accused us of being politicians and not scientists, and being more of acting towards political goals rather than scientific. And I was really angry to hear that. Number one, I'm very left-wing. I'm a Democrat. So to be insulted by my own party and discredited as someone who's looking for political gains or something, I thought it was just ludicrous. And also, all I do is work as a doctor. And then also just spending a year just seeing so many mistakes and so many things that people are getting wrong. I gave what I guess is an impassioned speech, but boy, did people seem to respond very positively from all over the world. I mean, like every country, translated it and put it up everywhere, and it was pretty interesting.
Yeah, and this is before the Senate, so it's the leading. But this is the leading legislature in the United States, isn't it? They can.
Yep.
Yeah. Also on Twitter, and that your website can be found through your Twitter bio. I will say, to the extent that platforms are taking down the material that you're putting up, this is madness.
Yeah, I know.
Right? This is madness. You are a domain expert. You are clearly motivated by concern. What you're saying is, whether or not it is correct, it is perfectly rational. It is highly logical and can be interpreted by anyone who has the scientific training enough to follow such an argument. That the idea that you are somehow a hazard by virtue of engaging in very serious questions on which a great deal of human well-being rests is preposterous. These platforms are in no position to evaluate what you're saying, and that means we have to be able to discuss it in public.
Well, that is what I'm calling for since many, many weeks, because the way the discussion is conducted right now is that, well, some fact checkers reach out to some experts, and then you have some one-liners in their report, some one-liners that, so to say, contradict what I'm saying. And then the fact checker confronts me with this kind of, contradictory statements, so to say. That is not a discussion, and that is, and I'm asking all the time, for these experts to start a debate, right? Like we are discussing. Then things can be clarified, and arguments can, and we could. I would love to see a consensus on what is going to be the criteria that we all agree upon to say whether or not human intervention is driving is driving immune escape, right? Because if there is really immune escape driven by human intervention in the way we have been discussing, then I think everyone will agree that this is not a good thing. This is really very problematic. But if we don't have criteria and if we don't agree upon, I mean, the only thing will be vaccinate everybody, right? Till not everybody is, unless everybody is vaccinated, it's not over, right? And that cannot be, according to my interpretation.
Everybody is incredible. The number of young people that I hear are being vaccinated is preposterous in light of the fact that there's really almost no reason to do it. No. Even if the vaccine is as safe and good as it's being portrayed, the fact is young people are already immune, and there's no reason to intervene in the
situation. And actually, it may be sad for some of us. It is tragic for many who are actually going through this, do not have the right medication available, and then they're aware that there is something that can work. I still cannot imagine that judges are asking to administer the drug, and I'm sure that folks like you are presenting to them that, hey, it is a safe drug. If I just walk over to my kitchen right now and take this drug, it's safe. And so somebody who is knocking at the death door, offering him just out of compassion, yes, to say, man, we're going to try this as well. We're going to try to save you. We're going to try our last, whatever we can. We would not leave any stone unturned. They cannot even bring themselves to this much. I am just shocked.
King Bean, the judges, I've now been able to be privy to what's going on in these courtrooms. The judges are appalled. They are absolutely crushing these hospital lawyers that are coming up with these terrible arguments. And they're really trying to advocate and protect these patients in society. That's how warped our system has become. I mean, that's why I'm asking the doctors, got to speak up, stop being cheap.
Absolutely. The damage is not just in the US at this time. The associations, the organizations like WHO, FDA, CDC, they have influence in the whole world.
Yes.
I talk with my friends outside of this country and I say, administer this drug, it would help you. And they say, your FDA did not approve it.
And it's a failure of guidance. And that's why I'm encouraging, again, I don't want to disparage those agencies because there's plenty of good people in those agencies. And there are plenty of well-meaning people in those agencies. But I think more have to speak up and act.
2020 was the year in which medical practice lost contact with the very essence of what it is supposed to be. The combination of misplaced microbe theories, the unhealthy influence of Big Pharma, and the monopolised regulation of medical practice all coming together to bring most of us a total disaster. Don't get me wrong, there are still lots of great aspects of medicine and people who genuinely want to improve it. Personally, I think there is reason for optimism, as 2020 saw the political medical industrial complex cause a crisis which woke up more of the world to the nature of the beast.
See yourself as spearheading this movement of awakening, because they need you. So not only your patients need you, your colleagues need you, and then the work that you do, which is wonderful, will be enhanced immeasurably by bringing a different state of consciousness to it. And once that happens, then the entire system may begin to undergo a change. Change always begins within.